from what I learned in trying to dig into all of this, that there's so much interconnectedness, and it's not that anyone's done anything wrong. No one did anything wrong in our case. All the doctors were on the right track and they did the best they could. And we would have gotten there eventually. With this particular disease, there's not much time. And even then, there's no cure. And it seems that the approach, the approach can be, we're all in this together. The people who are suffering, their families, and the doctors. These diseases are bigger than any of us, and it's going to take all of us to figure it out. And I think the reflecting back to the doctors from the patient side can only help. And more people that talk about their stories and don't feel ashamed about it, that especially the symptoms that you can't, there are no physical, clinical issues. I think our temptation is to think that, well, this person is just making it up, or it's not really real. And like in Robin's case, his symptoms were very real. The paranoia and delusions were very real. And the more that we can, I think, talk about it and share about it, it can only help. So, and I think the work that the American Brain Foundation, the reason I'm very drawn to what they're doing is they're looking at the whole brain, which is what, again, in this process, I saw, Robin's symptoms and what was going on in his pathology. He had tau, he had amyloid plaque, along with the alpha-synuclein deposits. It indicates there's crossover. There's so much crossover. He had, there was a little bit, that's the beginning of Alzheimer's. There's all these things going on. So the American Brain Foundation looks at the total picture, and that opens up the idea of, well, you can cure one. In curing one, or researching one even, you might find cures for others, and opens up more of a discussion amongst everybody. And I think that's where I'd like to help out, and of course with Lewy body disease in particular as well. So, long-winded answer, sorry. It's been a hot topic, and I hope to do what I can.